Good evening. I'm Steve Beatrice, your president, and I want to do a little housekeeping before we get started tonight. We have two wonderful speakers. First of all, be looking in your email the next few days. The CE certificates for the previous live webinars are going to be sent out. Also, the links to the taped sessions will be coming out soon, so look forward to it in your email. Tonight is a very special night. We have a keynote speaker, and one of my very best friends is presenting tonight, Dr. James Hunt. This lecture is sponsored by the American Board of Special Care Dentistry. I've known James for approximately 15 years, and during that time, I've been amazed by him as a person, by him as a practitioner, and as him as an advocate for our patient populations. He's worked for Special Olympics. He's on the National Committee for the Down Syndrome Association. In 2018, he was recognized as the outstanding national healthcare provider for the Galisano Foundation. Without further ado, I want to bring James on, and thank you, my friend, for presenting tonight.
Thank you, Dr. Beatrice. So tonight's topic, I'm James Hunt. I'm an anesthesiologist. I know that sounds a little odd to have an anesthesiologist talking to you virtually, and I'm glad you're willing to participate. I hope some of the reasons why I might talk to you versus somebody more esteemed like your president, Dr. Beatrice, will become apparent here in a few minutes. The title of the lecture you've seen for the last couple of weeks, and what we're particularly talking about here in general, is going to be those patients that may be a little more difficult to get to cooperate, or we may have a little more difficulty understanding why they don't want to cooperate. Some objectives for the evening. I hope we'll find some common ground for behavioral components that influence the way we interact with populations of people with intellectual disability in particular. And we'll talk about that category population as we go along.